Hello YouTube, this is MzCAGOMEA, and I wanted to talk to you guys about something I may have mentioned before in the past, but I'm not sure. It's called lymphedema, and I have lymphedema, but I got it from, there's different ways you can get it that I hear of, and all of it is basically there's some damage caused to your lymph nodes. And your lymph nodes are all over your whole body, and they help filter out bad things, to keep you healthy and keep you from getting infections and stuff like that. But for the guys that know me, you guys know that I was diagnosed with breast cancer when I was 25 years old. But as a result of surgery and having lymph nodes removed, I have lymphedema. And it causes swelling. And some people, they notice it right away. I thought I noticed it right after I had surgery, but I wasn't sure because of surgery, and you swell anyway when you have surgery. But it makes the body part feel really heavy, and you get like a tingling, numb feeling, and sometimes it's real achy and painful. And with me, I think it causes joint pain because I've been having a whole lot of joint pain lately. So I have it in my right arm. My right arm is a lot bigger than my left arm. See that? I don't know if you can tell. It's bigger than my left arm. So, like this. Left, right. And it swells, and it really does interfere with some things when it acts up. I have a pressure garment that I have to wear. I have it right now. I don't have it on because I just took it off so I could show it to you guys. This is the gauntlet. This is the part that goes on your hand. It was like $35 just for this little piece right here. And it just slides on your hand like so. Once you put it on, it's like your movement gets a little limited, but not too much. But it is hard to kind of move your thumb around. They're really tight. And some people get them with the fingers, but I got mine without because it feels better this way. And then this is the arm sleeve. And you have to get fitted for these. You can't just go get one. You have to get measured or measure yourself. If you're going to go on a site and measure yourself and go by their guidelines or whatever. But I went to the actual medical supply place and got measured. There's ladies in there that actually do just mastectomy supplies and handle breast cancer patients and stuff like that. So like they have an area in there, private area in there for women to go in, so you don't have to get all embarrassed when you're going to get fitted for all your supplies. So you just slide this on. The first time I put one of these on it was difficult because my arm was swollen really, really bad, and it was like I had to have help to get it on because it's so tight. It's skin tight. It sucks everything in, and what it's supposed to do is help push fluid back out of your lymph nodes and get it like circulating through your body. You have to take really good care of yourself and your skin and your body when you have lymphedema. You have to do that anyways, but you have to be extra careful because if you do something, you can get infections in the place where you have the lymphedema. So you have to take care of that. You have to moisturize daily, and try to keep your skin soft and try to keep the swelling out. I did go to see a specialist, a lymphedema specialist, where I had therapy and like they did like massage therapy or whatever. And when you think about massage, you think, oh, it's gonna feel so good. I'm gonna get my body massaged, but I mean, it was relaxing, but it wasn't like deep tissue or nothing. They just really focusing on like the necessary things. It's more of like this light rubbing like this, and they show you exercises to do to keep it out, keep the fluid out. But recently I took a trip to my sister's house and I forgot my sleeve. And you're supposed to always wear it when you travel. You're supposed to wear it. I'm supposed to wear it every day, but I don't. You're supposed to wear it in extreme temperature changes, like it's been really hot this summer. In the winter, it gets really, really cold. And I'm on the coast, and my sister is inland. So the temperature is always a little cooler here than it is there. And then I got on the train and went there. As soon as I got there, my arm just started swelling. And it got really heavy, and I've been having problems out of it ever since. But I keep trying to do the exercises they showed me. And, a lot of fist pumping. It makes it feel good when you do, like, the fist pumping and stuff like that. And rubbing it. Try to just rub it out and keep your sleeve on. I keep this thing on all day right now because it's just painful when I take it off. I've been having a lot of wrist pain and elbow pain, shoulder pain. I heard that a lot of times you have that pain because the arm is actually a lot heavier than normal. So yeah, I've been having to deal with that, but I am. Oh, and these things are really ugly. There are things you can buy to cover them up. That's like the main reason I don't like to wear it. At first it was really uncomfortable because it was so tight. But now it's like relief. It's tight and it's hot, but it's like relief from pain. But there are things you can buy to cover them up. I've even seen recently the sleeves that are made with colors and patterns and stuff. I don't think I need that, but I do. I've never bought one to cover it, but I make my own. I use little girls' tights. If you get the thick tights that the little girls wear in the wintertime, you can cut the leg off and then cut the toe part out and cut a hole for your thumb. And you can just slide it right over there, whatever color you want. Let me see if I have one. Hold on. Wait a second. Okay, so this is kind of what I'm talking about. It's like makeshift. This is a gray one. So like I could wear this today because see, my top is gray. So if I wanted to match my top, I can just take the pair of tights. This one didn't have a foot. It was just like the toe out kind. So I just cut a spot on the side for my thumb to go in. Cut the leg off. Let me show you. Just got sliding on. Hold on. Give me a second. Okay. And I just slide it on over this. And it kind of hides it. You can tuck it in at the top if you want. And let it be. And then you have a gray one instead of a beige one. It's gray. The thumb still shows, but I think that's a lot better than the ugly beige color. It's supposed to be skin tone, but of course my skin is not that tone. But now it matches my outfit. But anyways, I've done a lot of these different colors, patterns, stuff like that, and they only cost like $3, and you get two. So if you want to wear like one on each arm and match, you can do that because you got two legs. Okay? But let me see what I want to talk about. You have to wear your sleeve when you work out, and I've been working out a lot lately. And it's actually been causing me some trouble with the pain I've been having because you cannot really do any push-ups if you have lymphedema in your arm. Repetitive movement makes it swell. Typing a lot is kind of hard, really hard. I've been having trouble doing that. I've been trying to load stuff up on the blog that I have, and the typing is hard. It's really making my wrist and arm hurt and everything else. Need to wear it in extreme weather, excuse me. It's ugly, so you have to improvise to make it match your outfits, unless you just don't care. Let me think. You can't lift things that are too heavy. If you're, it sucks if you're right-handed and your lymphedema is on the right side. So I'm right-handed and my lymphedema is on the right side. So it's like you have to try to learn to be able to do things that you do with your right hand with your left hand. And when I was younger, I had surgery on my left hand, so it makes it kind of hard to kind of. But anyways, we are making it through. Ain't that right? Yes, we are. But I wanted to talk to you guys about that. You just gotta be really careful and take care of yourself. If you catch it early, it's better. As soon as you feel like you're having a swelling, I know that some people are having chemotherapy, like I did, and you get the tingling anyways in your fingers and hands, and it's hard to tell the difference between that tingle and the swelling tingle. I still have, the tips are kind of numb still. Of my fingers, the tips are kind of numb, but I think that's because of the swelling, because the tips on my other hand are not so numb. And then I'm starting to get feeling back here, because when they remove lymph nodes from under my arm, there's some kind of nerve that sometimes they have to touch or whatever, and you can lose feeling there. I did lose feeling for a long time there, but I can kind of feel stuff there now, which is cool, but not so cool, because it's like you can feel more pain than anything else. It's like you can't really feel a lot of sensation, but if something hurts, then it really, really hurts. I don't know, it's weird. I don't know. But anyways, if you guys have any questions about lymphedema, or think you might have it, or anything you want to talk about it, woes, or have any advice for me, you can always hit me up. You can find me on Facebook too at Kagome First. You can find me on Twitter, Kagome. You can find me on Tumblr, Kagome. You can find me. Where else can you find me? I'm on WordPress. I have some jewelry on WordPress. I'm getting my site up there. I've been making jewelry, but I haven't been making any recently because my arm has been killing me. I do that. I'm everywhere. Just like Google Kagome and I'm there. So, yeah, I'm on Black Planet too. I'm up there chatting when I'm bored. So, anyways, I just want to bring that up, and anything else you guys want to talk about that's concerning breast cancer or any other thing like that. I just had a birthday. Thank God for another year. And yeah, I've been cancer free for 4 years now. And I'm almost out of the high risk zone. I'll be there, like I won't have to see my doctors. So you gotta keep your diet good. You gotta eat those veggies and stuff like that. I promise you, I won't promise. I can't promise. I'm not gonna do that. But with me and my cancer, the cancer that I had, I won't claim it as mine. But the cancer that I had, I was a vegetarian after I finished all my chemo, radiation, surgery, all that stuff. I became a vegetarian, and then the numbers that they go by to determine whether you have to do chemo again, they dropped they plummeted. And right now, I eat poultry. But I still don't eat any red meat or anything like that. I don't eat no hamburgers or I don't eat no pork. I don't eat any of that stuff. But I do eat poultry. I don't really buy it and cook it in my house, but like if I'm somewhere else, I'll eat it. So mostly fruits and veggies in the water and stuff like that. I have a juicer, but I don't use it because it's a pain in my butt. But anyways, need advice? Let me know. Need to talk? Let me know. Know someone with cancer, all the fellow survivors, caregivers, anybody out there that wants to talk about anything, just let me know. I don't care. I'm here. But that's all I have to say. Love you guys. Be aware. Catch things early. Don't wait till it's too late. And just stay on top of it. Talk to you soon. Bye.